Good afternoon, everyone. It's my extreme pleasure to welcome you to the Guelph Family Health Study Distinguished Seminar Series. My name is Dr. David Maw, and I'm the director of the Guelph Family Health Study here at the University of Guelph. To start, I'd like to first begin with the land acknowledgement. The University of Guelph resides on the treaty lands and territory of the Mississaugas of the Credit. We recognize this gathering place where we work and learn is home to many past, present, and future First Nations, Inuit, and Métis peoples. Our acknowledgement of the land is our declaration of our collective responsibility to this place and its people, histories, rights, and present. Our school supports and adds our collective voice to the calls to action from the Truth and Reconciliation Committee on Indian Residential School to never forget to hold governments and colonial forces to account, to seek redress and healing for injustice. Before we move into the seminar, I wanted to take the opportunity to say a few words about the origins of the seminar series. Since 2014, here in the Guelph Family Health Study, we have been conducting research on many facets of family health and recognize the importance of connecting what we and others do with our families, general public, and our many friends and families. So towards this goal, we established the Distinguished Seminar Series to highlight important work and activities related to how we live, work, and play, and to bring science to the community and beyond. We also endeavor to support training development, our future leaders who will have an opportunity after the seminar to connect with our speaker. So today we are so pleased to welcome Stephen Norman from Health Canada to peel back how Health Canada operates to support the health of Canadians through food. And to introduce our speaker and bring words of welcome from the university, I'd like to introduce Amy Atkinson from Alumni Affairs.
Thank you, David. And if I could just get a thumbs up from David that you can hear me as well. Okay. Thank you so much. Hello to everyone. Welcome. Thank you for joining us today for what I'm sure is going to be a fantastic conversation with Stephen Norman. David mentioned my name is Amy Atkinson, and I have the absolute privilege of representing the University of Guelph as Director of Major Gift Advancement. And this role provides me with a unique opportunity, really, to work with incredible alumni like Stephen and friends to help elevate institutional goals and support students through engagement and fundraising. Personally, I'm quite drawn to the work of the Guelph Family Health Study as one of the over 700 families who participate in the study. Its mission in transdisciplinary research, knowledge mobilization, and training to support the health of children and families resonates with me as a parent, but also with the core values and mission of the University of Guelph. We believe that through power of rigorous scholarship, unparalleled creativity, and solution-oriented discovery, we can and all will improve life. Stephen's pathway demonstrates the pursuit of shared knowledge and using this knowledge to assess health risks and benefits, set standards, policies, regulations, and provide advice and information on the safety and quality of our food. As Canada's food university, we are proud of alumni like Stephen representing our shared interest in this important space. Stephen, it is so nice to meet you virtually, and I would say welcome back to your alma mater and campus, but we're virtual, but welcome. A little bit more about Stephen. Stephen is the director of the Bureau of Nutritional Sciences in Health Canada's Food Directorate, where he oversees 3 divisions responsible for nutrition research, regulations and standards, and pre-market assessments. He joined the Pesticides Directorate of Agriculture and Agri-Food Canada in 1995 and worked at the Canadian Food Inspection Agency in various roles from 2001 to 2018, including as laboratory director and overseeing national food laboratory operations and surveillance. Stephen joined the Food Directorate in January of 2019 as the director of the Bureau of Chemical Safety, and then quickly moved into the Bureau of Nutritional Sciences in 2021. Stephen received his Bachelor of Science degree in biology from the University of Guelph in 1994. And as you can see from Stephen's success, life can take you in many different places from your time here at the University of Guelph. So I would like to thank you, Stephen, for being here, and I'm looking forward to hearing your talk. And over to you.
Thanks so much, Amy and David, for those kind words. I appreciate it.
I'm just going to interrupt just a little bit to provide a little bit of housekeeping. So for our attendees joining us, for your questions, please use the Q&A button at the bottom, and then we'll collate and address them at the end of the presentation. And we're also going to drop the PDF of the slides into the chat, so attendees can also follow along that way as well. Over to you, Stephen.
Thanks very much, David. And I think you're going to share the presentation on the screen. Okay, that's great. I'll just get set up. And sorry I couldn't join you in person. We're really focusing on trying to do things virtually these days, like so many people. Next slide, please. So I'd just like to say I'm really pleased to have a discussion today, and I'm looking forward to the comments received and trying to answer, I think, a little bit more after. So I've got a few slides to introduce Canada's food safety system, and then to give you some concrete examples of initiatives that we've undertaken recently by Health Canada to ensure the safety and nutritional quality of the food supply. So please do share your questions, and as David mentioned, we can address those afterwards. Next slide, please. So I think, as many of you know, that the food safety system is really a shared responsibility between industry, consumers, and governments in Canada. Next slide. Anyone selling food in Canada is responsible for ensuring that it is safe to eat. Consumers can also help protect themselves and their families by learning about food recalls and allergy alerts, and by following safe food handling practices at home. Next slide. So Canada's Constitution allows all levels of government, federal, provincial, territorial, and municipal governments to enact food safety and quality legislation, establish policies, standards, laws, and as well as enforcing them, providing information and guidance, and delivering programs. Next slide. There's a number of key pieces of legislation in Canada, and I'll just touch on those here. The Food and Drugs Act, which first came into effect in 1953, is really a key piece of legislation, which is administered by Health Canada, but enforced by the Canadian Food Inspection Agency. And the premise of the Act is to protect the Canadian public from health and safety hazards and fraud by governing the sale and advertisement of food. It prohibits deceptive activities, outlines the authorities that can be exercised by inspectors, and enables regulation-making authorities. So in 1997, the CFIA Act established the Canadian Food Inspection Agency, being responsible for enforcing the policies and standards pertaining to food as set out in the Food and Drugs Act. And in 2012, the Safe Food for Canadians Act was implemented to strengthen and modernize Canada's food safety legislation by consolidating the food provisions of the various commodity-specific acts. For example, the Fish Inspection Act, there's a Meat Inspection Act, the Agricultural Products and Consumer Packaging and Labeling Act. So there were about 14, or in fact, there were 14 different acts that were consolidated in 37 sets of regulations. And that all went into the Safe Food for Canadians Act and the Safe Food for Canadians regulations. So you can understand the amount of work that must have gone into that, and the real support from industry too, to try to have clarity instead of different rules for each commodity, having one set of essentially outcome-based regulations that would apply to food sold in Canada. Next slide. I'm just giving you a snapshot of some key federal organizations and what their roles are. So Health Canada develops food safety standards and policies to minimize the risk of foodborne illness. The Canadian Food Inspection Agency conducts inspections to ensure that the food industry meets its food safety responsibilities. The Public Health Agency of Canada monitors outbreaks and deals with epidemiological issues while providing advice to protect public health. And Agriculture and Agri-Food provides information and assistance to help industry understand the food regulatory requirements. Next slide. So Canada's health portfolio is essentially the departments under the authority of the Minister of Health. includes Health Canada, the Public Health Agency of Canada, CFIA, the Canadian Institutes of Health Research, and the Patented Medicine Prices Review Board. And within Health Canada, there are different branches. And so I'm part of Health Products and Food branch. Next slide. So the Health Products and Food branch mandate is to manage the health-related risks and benefits of health products and food by minimizing health risk factors to Canadians while maximizing the safety provided by the regulatory system for health products and food. So you'll notice here that there's the Food Directorate where I work, and then there's something called the Office of Nutrition Policy and Promotion. And so I think everybody will be familiar with Canada's Food Guide, and that's led by the Office of Nutrition Policy and Promotion. So when the Public Health Agency of Canada was created, most of the health promotion work went over to the Public Health Agency, except for nutrition and Canada's Food Guide. That stayed with Health Canada and is led by the Office of Nutrition Policy and Promotion. So they do dietary guidance, and we can talk a little bit more about that later. Whereas the Food Directorate has more of a health protection role. And so I'll talk to you about some initiatives that are in the Food Directorate and how we implement those. And I'd welcome questions after, and we can talk about other things that group does. So one point to touch on, I think, is really how the Food Directorate differs from health products. So those include drugs, devices, vaccines, natural health products, etc. Food is managed largely after it enters the marketplace. So the companies are required to comply with regulations that we talked about earlier, whereas health products are assessed before they're permitted to be sold. And so it's a fairly significant difference. And it does affect the mandate and the role of the organizations that we'll be talking about. Next slide. So the Food Directorate is the federal health authority responsible for assessing health risks and benefits, setting standards, policies, and regulations, and providing advice and information regarding the safety and nutritional quality of food. And so today I'm going to provide you with some concrete examples of activities undertaken to ensure the quality and safety of the food supply through establishing of regulations and guidelines, the pre-market scientific assessment of certain foods, the development of scientific evidence to support risk analysis, and the establishment of standards and policies. Next slide, please. So I don't want to bore you with org charts, but essentially the Food Directorate is composed of 6 different bureaus under the leadership of the Director General and our management committee. And so 3 are science-based bureaus that implement the Directorate's core program in food risk analysis, research, standard setting, and market authorization. So I'm in the Bureau of Nutritional Sciences, but we have a Bureau of Chemical Safety and a Bureau of Microbial Hazards. And then the 3 other bureaus are horizontal bureaus responsible for policy, science integration, and surveillance, and operations. And that has to do with admin and finance, HR, procurement, that kind of stuff. Next slide, please. So there's some key concepts within the regulations, and we did speak briefly about industry's role in the safety and nutritional quality of the food supply. And this role is governed by regulations, which may be prohibitive, such as limits on different contaminants in different foods. We've got aflatoxins in nuts listed, or arsenic in rice, etc. They can be prescriptive, so those would include standards and requirements such as food composition, nutritional quality, and labeling requirements. Or enabling. So some foods require pre-market assessment before they're allowed to be introduced into the market, that they require an assessment by the Food Directorate. So those include novel foods, food additives, and infant formula. Next slide, please. So I'll talk about 2 examples of regulations which we passed recently. And some non-regulatory tools to support their implementation and understanding. Next slide. So as you may know, there's ample evidence linking diets high in saturated fats, sugars, and/or sodium to increased health risks, such as obesity, heart disease, and type 2 diabetes. Surveillance data show that Canadians consume these nutrients in excess of recommended limits, And as part of Health Canada's healthy eating strategy, final regulations for front of package nutrition labeling were published on July 20th, 2022. And these regulations require that most prepackaged foods containing saturated fats, sugars, and/or sodium, which meet or exceed specific thresholds, that they be labeled with a nutrition symbol. And the front of pack nutrition symbol, which you can see on the top right of the package there, it has a magnifying glass and then 3 bars, and it says high in, and there's a place for sodium, sugars, and saturated fat. So the idea is that if, as a consumer, you approach, you're shopping, you're busy, you have your kids sort of tugging at your coattails, that you can see on the front of the package information which helps you to identify foods quickly that are high in nutrients of concern. So high in nutrients that you should limit. And this balances what you typically see on food package, the front of package, which are positive claims. Like this in the bottom left says a high source of fiber. So essentially, this was intended to make it quicker and easier for people living in Canada to make more informed food choices. And regulated parties have until January 1st, 2026 to comply with the new requirements, but the nutrition symbol may appear earlier on certain foods. Next slide, please. So front of package labeling rules consist of 5 main parts. There are thresholds, nutrient thresholds, exemptions and prohibitions from the regulations, nutrition symbol design, nutrition symbol formats and specifications, restrictions on the use of health-related representation. So that means restrictions on health claims. So if you have a product which is high in sodium and has the symbol, then you can't also have a health claim saying that it's low in sodium. You could have that the sodium has been reduced or it's lower sodium, because we're trying not to discourage companies from actually lowering the nutrients concern in their products. And if adding a health claim there doesn't cause confusion, then the regulations will permit it. So as part of these changes, the directory of nutrient symbol specifications and the table of permitted nutrient content statement claims have been incorporated by reference into the regulations and can now be amended by the department. So I know that's a bit of a mouthful, but what it means is that when we're going forward with regulations now, instead of prescribing things in regulation that are very, very difficult to change and should be updated to keep pace with change, modernization, scientific innovation, new evidence, that we're using a tool called incorporation by reference, which essentially means that you can have a document or a list which is incorporated into the regs, but that we can change it through an administrative process. So that process includes a consultation where we have a proposal that's posted and a comment period, and then we would announce through a notice of modification that a change has been made to a list, for example. So this allows regulations that are made now to be remain up to date, as opposed to those that were made maybe 40 years ago and we're still struggling to update. So additional tools are also available to help regulated parties comply with the new requirements, such as ready-to-use graphic files and nutritional symbol variants. So they can download these or receive them from the department and then apply those symbols to the products. And then nutrition symbol labeling guide for industry. Next slide. So that's the labeling guide I was mentioning, and it's available on our website. It's about 70 pages for industry folks, and it gets into quite specific detail. The guide provides really sort of a practical interpretation of the requirements associated with the 5 main parts that I mentioned before. And it does not have the force of law, but it helps, for example, where the guide would provide information on how to apply the front of package symbol to products containing an assortment of food, such as a package of cereal bars, or to products containing foods intended to be eaten together, such as a charcuterie platter. The guide also provides examples of acceptable and unacceptable ways to present the symbol when one or more foods contained in the package requires a symbol. Next slide, please. So I mentioned these regulations were published in the summer of 2022, and that there's a transition period until January 1st, 2026. And so during this transition period, we'll continue to answer stakeholder questions about the regs and their intent, and we'll also communicate with the public about front of package nutrition labeling within the context of broader approaches to healthy eating education and understanding nutrition labeling. After implementation, we'll evaluate the impact of the nutrition labeling on consumer behavior, and we'll monitor the food environment to ensure that front of package nutrition labeling regulations are achieving their intended results. Next slide. So you'll notice that the date here, July 20th, 2022, was a really busy day at Health Canada, and we published another set of regulations for food on the same day. And we also supplemented foods are prepackaged foods to which vitamins, minerals, amino acids, and or other ingredients have been added, for example, caffeinated energy drinks, and that these ingredients are not added for a public health purpose. So essentially, we've shifted the regulatory framework from a pre-market approach, pre-market assessment, to one which is more efficient, where there are rules set out in regulations and companies are required to comply with them in order to sell products. So just to unpack that for a sec, supplemented foods, initially, there was a question about 2012 about should supplemented foods be regulated as natural health products because they include these ingredients which I mentioned, like vitamins, minerals, amino acids, caffeine, or should they be regulated as foods? And the decision was taken back then that the format which these foods are sold in, if it's consistent with a food, like a drink or a bar or gum, that it should be regulated as food. And so there was a transition period from about 2012 until the summer of 2022, where temporary marketing authorizations were issued by Health Canada to companies who wanted to sell, for example, caffeinated energy drinks. And that was really a product by product permission. And it took a lot of resources from Health Canada. It took a lot of resources from industry. And, you know, when you do things one at a time, there can be some inconsistencies. So it was agreed that the longer term approach would be to have regulations, which is more consistent for all food, that lay out, you know, what's acceptable, and then companies don't need a permission to sell it as long as they comply. Next slide, please. So the new regulations have 4 key elements. The first is the considerations of use for supplemental ingredients. In other words, determining which foods can be supplemented and which ingredients are authorized. And we've defined these conditions of use using 2 lists. There's a list of ingredients authorized for supplemented foods, and there's a list of food categories to which supplemental ingredients may be added. The second key element of the regulation concerns labeling. And due to the unique nature of supplemented foods, there are additional labeling provisions, such as a table of information on supplemented foods. So you're familiar with the nutrition facts table. Well, on the supplemented foods, there's something called a supplemented foods facts table. And it has the same requirements as the nutrition facts table at the beginning, but there's additional information at the bottom about supplemental ingredients. There's identification of supplemental foods with caution statements. So essentially there's a caution identifier, which is required if there's a cautionary statement on a supplemented food, you know, not to be consumed by breastfeeding women or children, then on the front of the package, there's a caution identifier that's required to be placed there. And that alerts consumers to the fact that they should look at the caution box on the back. And there are certain restrictions on health claims as well. So the third key element of the regulatory framework is flexibility. And since innovation will continue in this field and science will continue to evolve, particularly with regard to the use of certain ingredients and their levels. So I mentioned before incorporation by reference. So in this, we have these lists of supplemental ingredients and lists of supplemented food, and companies can basically put in a submission with data that would be evaluated, and we would be able to amend the list. And we would need to go through that notice of proposal process, receive comments, and a notice of modification. But at least there's a process there that we can amend it. And then if we amend those lists, it becomes a rule of general application where other companies would be allowed to use the same ingredient or supplement the additional food which has been added to the list, instead of the previous model where it was a product specific sort of permission. And then the fourth element of the regulatory framework relates to transition. And so existing supplemented foods, so those which had received an authorization previously during that transition period, will have until January 1st, 2026 to comply, while other new products need to comply with the regulations immediately. Next slide, please. So recognizing that there's kind of a lot that I just covered, right? Like there's a supplemented food facts table, there are caution identifiers, there's a caution box, and we want to help people understand this new information. And so we're developing an awareness initiative on the labeling of supplemented foods. And the approach taken for this awareness initiative is to develop messages focused on new label elements to help Canadians make informed choices when these labels are placed on products which are on the market. And those are starting to, you can see them on the market now. These images you see on the screen show the new label elements on which the initiative will focus. The left-hand side of the slide highlights the table of information, the supplemented food facts table. And so all supplemented foods must have a supplemented food facts table. It contains the same basic information as the nutrition facts table, and it includes supplemented with section at the bottom of the table that identifies any supplemental ingredients included in the product. And the footnote to this section explains that the amount shown includes both naturally occurring and supplemented amounts. The right-hand side of the slide highlights the caution identifier for supplemented foods and the 3 caution statements. Some supplemented foods must carry a supplemented food caution identifier, and this supplemented food caution identifier tells you that there are warnings on the back or side of the package. And these may include limit the number of servings per day, who should not eat or drink this product, and not to consume it on the same day as other supplemented foods or supplements containing the same supplemental ingredients. So if you take workout supplements or something, you need to be aware that some of these, added together can push you over the maximum level. So next slide, please. This slide shows the main objectives in blue that we address in our awareness messages. The objectives are followed by the main facts that support them. For example, objective number 1 is to explain what a supplemented food is, and the main fact is that supplemented foods are prepackaged foods containing 1 or more additional ingredients. Each of these 3 objectives and facts will be supported by sub-messages that will be adapted to the different audiences and platforms for which they are used. Next slide, please. So our awareness messages will be part of a toolkit that will be available online to all stakeholders. This toolkit will include the various elements listed on the slide. We're also collaborating with other departments and networks to disseminate the messages. Next slide, please. So regulations is one approach, but in some cases, guidance is provided, and sometimes that's voluntary guidance. So I'd like to give you an example of something that we're currently working on. And voluntary guidance documents are recommendations to our stakeholders, and we encourage them to comply, but these documents do not have the force of law. Next slide. So the sale of food products via e-commerce has increased in recent years, and it can be convenient. It can give access to a wider variety of foods and provide alternatives for people who may find it difficult to shop in a physical store. However, buying food via e-commerce can present difficulties for consumers. For example, the food information provided online is inconsistent and sometimes insufficient to guide consumers in their purchases. In general, Health Canada and the CFI propose that food information on an e-commerce platform should mirror the information required on the physical label of a food or beverage product. Health Canada and CFIA held a joint consultation on May 9th to July 8th of 2022 to inform the development of these guidelines. We received 750 responses from consumers, industry, health professionals, and academics. Next slide. So on February 21st of this year, we published a What We Heard report providing a high-level summary of the comments. It was published on CFI's website. And in general, consumers are in favor of all information required to appear on food packaging, and that also appear online, particularly allergen, ingredient, nutrition information. Industry stakeholders generally supported the proposed principles, but asked for flexibility in how they would be applied. Concerns and limitations were raised concerning data management, for example, the acquisition and management of food information, and inventory management. So in some cases, ensuring that the product which is advertised on a website is challenging to make sure that it corresponds to what the consumer receives. So online labeling for e-commerce isn't just an interest for Canada. Internationally, there's also work on this underway in this area. Next slide, please. So I mentioned as well something we do is pre-market assessment. I mentioned food additives, infant formula, and novel foods. And so I figured we could talk a little bit about infant formula as an example. Next slide, please. So all new infant formulas that are sold and manufactured in Canada are regulated by Health Canada. The regulatory requirements concerning the safety and nutritional quality of infant formula are set out in the Food and Drugs Act and regulations, and manufacturers are required to comply with them. Division 25 of the Food and Drug Regulations sets out the nutritional composition and labeling requirements for all infant formulas. And infant formulas may also contain optional ingredients, novel infant formula ingredients, which may also be subject to evaluation. So depending on the type of infant formula, pre-market notification may be subject to sort of a multidisciplinary review. And so what we do is, even though these are led by the Bureau of Nutritional Sciences, we have review and input with respect to microbial safety from the Bureau of Microbial Hazards, and from a chemical safety and toxicology point of view, that review's done by the Bureau of Chemical Safety. Next slide. So as you might know, over the last year and a half, the low supply of infant formula has been a difficult situation for many parents and families in Canada. There was a major manufacturing plant in the US which closed in February of 2022 due to contamination problems, and it remained closed for many months. So the plant manufactured several popular products that represented a significant share of the Canadian infant formula market, and its closure caused major market disruptions that continue to affect the supply of infant formula in Canada. Although the production at the facility resumed in July of 2022, the return to normal production has been slow, and it's not expected before the second half of 2023. So we're kind of there yet, but it's still not fully back to normal. And I would say that the challenge has been really an issue with all manufacturers now, that there have been sort of challenges globally, for example, because of the war in Ukraine, with the production of ingredients like sunflower oil that is a key ingredient in infant formula products. That's challenged. There's been labor disruptions, there's been recalls, there's been a whole bunch of things. So Health Canada has taken quite an active involvement in this. Next slide, please. We've worked directly with manufacturers to increase the supply of infant formula products normally available on the Canadian market, to identify alternative products that can be imported from other countries. And one of the main ways we did that was with an interim policy that essentially facilitated importation from other countries, which had similar safety standards to those in Canada. And all products under the interim policy are nutritious and safe. They come like I said, from countries that have similar standards. And we have done an assessment of the safety and quality before adding them to the list. So to date, more than 70 products have been approved for temporary importation, including products found on store shelves and other reserved for medical use. Next slide. So the interim policy made a difference, and overall it enabled the importation of more than 4.7 million units of hypoallergenic infant formula. So those are products for infants with food allergies, and into the country. And for a few months in the summer of 2022, the only hypoallergenic preparations available in the country were products imported under the interim policy. And when stocks were at their lowest, hypoallergenic preparations can only be ordered through a pharmacist. When the supply stabilized in the fall, hypoallergenic formulas began to return to the shelves, and the interim policy has allowed the importation of hospital products as well, particularly in December of 22, when many hospitals reported that they were unable to receive expected shipments of specialty products such as human milk fortifiers. Next slide. So since the beginning of the shortage, Health Canada has played an important role in convening stakeholders. We've talked about our collaboration with industry. We've also worked with provinces, territories, and the healthcare community to share information and stay abreast of emerging issues. And health professionals interact directly with families, which is why we've prepared information packages for them containing useful information to answer their questions and guide their decisions. They've been important allies, and we've made sure to harmonize our messages. Next slide. So looking ahead, Health Canada is taking steps to have a more diverse and resilient market in the context where supply chain disruptions are more frequent. In the short term, we continue to use the interim policy to enable rapid supply of infant formula to alleviate the supply disruptions which still exist. And new manufacturers are entering the market with important products under the interim policy, and some have expressed interest in remaining in the market for the long term. And so although we recognize that breastfeeding is best, there are families who that's not an option for, and that infant formula plays an important essential role for their children. So having more manufacturers in the Canadian market means we are less vulnerable if one of them is affected by a major event, like a shutdown of a facility or a recall. Next slide, please. So finally, I want to talk about a couple examples of scientific initiatives that are essential to support the development of Health Canada's policies and regulations. Next slide. So one is dietary reference intake. So since the mid-90s, the governments of Canada and the United States have been working together to develop dietary reference intakes, or DRIs. DRIs are nutrient intake recommendations that set values related to meeting nutrient needs, values to prevent excessive intakes, and values to reduce the risk of chronic disease for individuals and populations in Canada and the US. Next slide. The DRIs are the basis for a large number of government and non-government uses, such as assessing nutritional intakes and monitoring the nutritional health of the population, developing nutritional labeling, developing dietary guidelines and guides, ensuring that foods and food supplements contain safe levels of nutrients, creating counseling and education programs for patients and consumers, as well as research and methodologies. And since they underpin most of our nutrition-related policies and activities, it's vital to keep them up to date. Next slide. So for this reason, the two governments have established a joint working group on dietary reference intakes, which works in partnership to identify needs for DRIs, prioritize revisions, and provide funding to support the revision of values. So over the next 5 to 6 years, it's been established that the priority is to revise the dietary reference intake values for all of the macronutrient components. As part of the macronutrient review, the DRI for energy have been re-examined, and the report presenting the new estimated energy requirement equations was published in January of 2023, and the link, you can't see it there, but the link is at the bottom of the slide. Next slide, please. So the other example of scientific initiative that I wanted to talk about is the revision of the analysis approach and the dissemination of information on the nutritional status of the population based on data from the Canadian Health Measures Survey. The goal is to take consistent approaches to analyzing data over time, strengthening measures where necessary, and regularly reporting results in the scientific literature and to the public. So I'll just mention two articles that were recently published to highlight this work. So we have a Canadian Health Measures Survey lab within the Bureau of Nutritional Sciences, which essentially tests samples which are collected by Statistics Canada as part of this survey. And so like blood and urine samples. And so we look for nutritional biomarkers in there and then use that data as well. So slide 38, please. So the first article examines the iron status of the Canadian population by combining 4 cycles of survey data from 2012 to 2019. And the article presents new approaches to correct inflammation in serum ferritin. And the main results show significant gender differences across the iron status continuum, and a moderate magnitude public health problem related to iron deficiency was identified in women aged 14 to 50 years. Next slide, please. A similar approach was taken for vitamin D. And the second article focuses on vitamin D status of people aged 3 to 79, and again combines 4 cycles of survey data between 2012 and 2019. And the results tell us that most people in Canada have adequate vitamin D status. Nevertheless, racialized groups have a high prevalence of inadequacy. Further research is needed to assess whether current strategies aimed at improving vitamin D status, including increasing vitamin D in fortified foods and dietary advice aimed at including a source of vitamin D each day, contribute to reduced health inequalities in Canada. So by combining these sort of 4 cycles of CHMS, it's enabled scientists within the Food Directorate to dig a little bit deeper and see, aggregate data together and look more at vulnerable populations. So that's something which is important these days in Canada. We have a very diverse population, and we need to understand what people are eating, what people in different communities are eating, and how, what their status is for certain nutritional biomarkers. So this is a good example of that. Next slide, please. So I just wanted to say thank you. I'm 4 minutes over, I think, but we've got information which is available if people happen to be interested. This CSIMS is a stakeholder registry, basically, and you can sign up if you're interested in information from Health Canada, and you can click on areas that might interest you. So if you're interested in vaccines or in health products, you can click on that. If you're interested in food and food standards, you can choose that. There's also some social media channels shared here. And I've put the Food Guide newsletter. And so this is that Office of Nutrition Policy and Promotion, and I'm sure they would be happy if you subscribe to the newsletter. So thank you very much.
Thank you, Stephen. That was a fantastic presentation, and thank you for peeling back the inner workings of Health Canada, the Bureau of Nutritional Sciences. So we have some questions posed in the chat, and so I'm just going to summarize them for you. There were a couple of questions related to knowledge translation mobilization, and the question was curious about what are current approaches and others that may be in the works to directly educate the Canadian public on how to use and interpret something like the front of pack labeling. So you highlighted a large guidance document for industry, but how about for individuals and families?
Sure, thank you. That's a great question. So the Office of Nutrition Policy and Promotion is responsible for dietary guidance and for educating consumers about nutrition labeling and how to use the information on labels. And so as part of their work, they're planning on including information about front of package nutrition labeling in that. I have to say though, when the symbol was designed and research was done to test how people can recognize and use the information, it was done in a way that assessed people of different health literacy levels. And the idea was that this should be simple. Like a nutrition facts table is already on the back of the package. We know that a lot of people either don't look at it or they don't understand it. And so the idea was the one piece of information that was required is something up front that makes it simple and easy to use. And so as part of that work, the whole premise was it shouldn't be something we have to teach people about. And although I'm saying that, we still, ONPP is still going to sort of provide some information to raise awareness, but it was really designed more for people to be able to use it without a lot of depth or additional knowledge.
Okay. So basically meant to be fairly intuitive right from the get-go.
Exactly.
Great. So a related question to the front of pack is a comment about the 2026 January deadline for food companies to be in compliance. And so these guidelines were published in earlier this year. And so there's a bit of a runway, but still the question, how confident is Health Canada that food companies have enough time to adhere to these guidelines and change the packaging or potential reformulation? And then the second part of that question was, what are the consequences if the day pass comes and goes?
Right. So the regulations were passed in July of 2022. So industry had 3.5 years to comply. And we've done webinars to raise awareness. Industry associations are quite aware. We've given presentations at industry association meetings and CL, the trade conference, in collaboration with the Food, Health and Consumer Products Association to try to raise awareness among companies, including small companies and importers, that this is a new requirement in Canada and that they will have to comply with it. So we've made efforts to make that aware, and a 3.5-year runway is a pretty big runway. We've also been working on this for quite a bit of time. It was front of package nutrition labeling was part of Canada's healthy eating strategy, which was launched back in 2016 and has been part of mandate commitments for a number of years. And so health stakeholders, conversely, are sort of asking the question, why does it take another 3.5 years? And in other countries, for example, Mexico, I think they give industry 6 months. So I think I'm fairly confident that industry will be able to meet that timeline.
Great. And kind of related to something you just mentioned about importing food. So Canada is a very multicultural country. There's a lot of supermarkets that cater to ethnic foods. So the question was, are these regulations applicable to these imported foods, and how is that regulated?
Yes, so they're applicable to food sold in Canada, and so over stickering is a possibility. That can be done, but those foods are required to meet the requirements of the Food and Drug Regulations. The Canadian Food Inspection Agency is responsible for compliance and enforcement of the Food and Drug Regulations as it pertains to food, as well as the Safe Food for Canadians Act and regulations. So it's essentially, that they're not planning on going out and doing a blitz of all products for FOP labels on January 2nd, 2026, but certainly they're going to receive complaints from competitors and whatnot, and that's sort of how our process works. It'll be an incremental thing, I suspect.
Okay, great. Shifting a little bit from the in-person to the online e-commerce, there was a question about the approach of using voluntary guidelines as opposed to mandatory guidelines for e-commerce equivalency of the same information that would be found on the physical package.
That's a great question. So in the in the regulations, what we have oversight for labeling on is the physical label. And so our approach has been to look at doing guidelines. We did hear in the consultation that many in the public said exactly that. We want this to be mandatory, right? And that this information, when I'm purchasing a product, I need to have it so that, you know, for example, allergen information, it's not fair if people can't really know that. It limits their choice. At this point, we're looking towards voluntary guidance because that's sort of what we're able to do.
Okay. The next question is related to some of the publications that you shared. And the question is about, are there plans from Health Canada or Stats Canada to collect additional dietary data, so updating the CCHS from 2015 and or potentially combining and working with the CHMS, as there seems to be some parallel activities there?
Yeah, so the Canadian Consumer Health Survey from 2015. So there's a nutrition survey, I think it was 2004, and then there was one in 2015. We need to do another one. And that this is a fundamental piece of information or, you know, source of data for so much of our work in terms of evaluating exposure, not only from a nutrition perspective, but when we're doing food additive assessments and other things, we really need it. These are very expensive surveys. They're led by Stats Canada, and we're seeking funding essentially to try to get a pathway to do the next survey. So I agree completely that that's something which is important. And I think generally surveillance data is something that we really recognize. It's a priority for so much of our work, but other people rely on it too. And so I agree with the comment that yes, it's an important thing we need to move ahead with.
All right. And so do you have a date? Sorry to put you in the spot.
For a next nutrition survey, unfortunately, yeah. I wish I could tell you, but I do not.
Okay, top secret.
No, we just don't. We don't have the funding to do it, is essentially the bottom line. And we have to seek funding to do it through various, you know, Treasury Board submissions or other mechanisms. So that's one of the things that we constantly are trying to work on.
Okay, so it's a work in progress, but there will be something down the road. Excellent. This one's a little bit of a technical question about the sugars on the front of the pack. So the nutrients of concern as it relates to the sugar labeling, is it specific to free or added sugars?
It's free sugars. So the World Health Organization recommendation is to limit free sugars. So those include sugars in juice. So we haven't focused only on added sugars because we're respecting the WHO definition.
Okay, so it's specific. So the labeling is for free sugars. Mm-hmm. Awesome. That's great. I was curious about the vitamin D work that was published. So I have a little bit of prerogative to ask my own questions. I was curious if there was complementary work done on calcium, because they go hand in hand.
So I think calcium status is being monitored. Maybe what I could do is get back with Hope Weiler, who would be able to get into your questions in lots of detail about, obviously, you know, from a fortification point of view, we're looking at vitamin D and fortifying foods, which, you know, are sources of calcium as well. So it's obviously part of the consideration. Yeah.
Okay. And another question that is being in the news of late, there's been a lot of concern around caffeine and all sorts of interesting beverages. And I was curious if you could comment about what Health Canada is doing and its thoughts on this interesting category.
Yeah, and that falls into the supplemented foods that I was talking about earlier, and those regulations that came into place last summer of 2022. So new products coming onto the market after that date are required to comply with the regulations which are here in Canada. And so the big companies know what those are. I think in some cases there were examples of people importing product, maybe not going through normal distribution channels. And then I think also you're sort of seeing certain companies having products which are recalled, and I'll just explain how that process works. If, for example, the Food Inspection Agency finds a non-compliance or has a complaint, before they recall a product, they would reach out to Health Canada for a risk assessment. And so part of that risk assessment is looking at the ingredients in the product and how the product is labeled. And so some of the products which have been recalled have either exceeded the amount of caffeine, which is permitted in the new regulations, so 180 milligrams per serving, or that they don't have the labeling requirements under the new regulations, or they don't have both. And so in certain cases, a health risk assessment has been issued to CFIA by Health Canada, which has led to a recall. And I think it is quite surprising how many recalls there have been, and it has got quite a bit of media attention. I think that, I believe, will kind of decrease over time because industry and smaller companies or people who are importing things through not the normal channels are, I think, learning about that quickly.
Thank you for that answer. Yeah, definitely all sorts of nutritional topics have come up in the media, and caffeine has been one of late. I'm also looking at time. We have a couple minutes spare, and I thought it'd be timely to wrap things up at this point in time so that you have a few minutes before we transition to the Zoom call with the students. And so I wanted to thank you tremendously again for sharing, spending the afternoon with us today. And please, just asking the attendees, please join me in thanking Dr. Norman for the presentation.
Thanks so much. I really appreciate the invitation and enjoyed the questions. Thank you.
And there's thousands of clapping hands.
All right, I'll talk to you soon.
Talk to you soon. Thank you again. Take care. And for attendees, just a reminder, the slides are available on the in the general chat if you wanted to download, and we'll take another minute before we shut things down. All right, Cynthia, why don't we shift over to our next meeting?
Okay, all right.